Hi there, I'm Dr. Jeremiah Peck with Ally Academy Northwest, and welcome back to our video series on the NCE or National Counselor Exam. In this video, we're going to be going in depth in the topic of human growth and development. Now, human growth and development is one of the 8 core content areas covered in the NCE. In this video, we're going to be looking at major developmental theorists that there will likely be questions about on your NCE exam. Now, the topic of human growth and development has about 12 questions of the total in your total exam, which is about 8% of the total exam itself, or total 160 questions that count towards your final grade. That is, of the 200 total, 40 of which do not count, as I discussed in a previous video. Now, when you're thinking about human growth and development, it's very helpful to remind yourself of the developmental theorists that propose ways in which people grow, learn, and operate. Familiarize yourself with the theorists as well as their theories. They fall into certain camps and categories, and questions in the NCE will likely ask you about these theorists and what these theorists said, sometimes as it relates to specific clients or what stage a client might be in. I would recommend not trying to memorize the details of these. Familiarize yourself that you can associate the theorists with the theory, but look for a big picture idea as you listen to and read about these theorists. The first theorist I'm going to talk about is Erikson and the stages of psychosocial development. Now, one way to remember is psychosocial has these 8 stages. And if you think of Erikson 8, so EEE, Erikson and his 8 psychosocial stages of development. The 8 stages are trust versus mistrust, which is from about birth to 1.5 to 2 years. Autonomy versus shame and doubt, which is about 2 to 3 years. Initiative versus guilt, 3 to 6 years. Industry versus inferiority, 6 to 11 years. Identity versus role confusion, 12 to 18 years. Intimacy versus isolation, 18 to 35 years. Generativity versus stagnation, 35 to 60 years. And integrity versus despair, which is about 60, 65, and beyond. Now, as these are psychosocial stages of development, some of the questions may ask you to match Erikson with this developmental theory specifically, or it may ask if you're seeing a client and giving you a specific scenario and they disclose that hypothetical client's age, they may ask, what stage of Erikson would this client be functioning at? Or if this client experienced trauma, what stage might they have experienced arrested development in? So if they say the client is 10 years old, then you would think to yourself, well, 10 is between the ages of 6 and 11. So likely that industry versus inferiority, a great deal having to do with can I make it in the world of people and things? Is what I'm doing acceptable? Autonomy versus shame and doubt, which is that 2 to 3-year-old place. That's that part where it's not an externalized measure of performance, but instead an internal experience. Am I okay? Am I acceptable as a person? And we know that if tragically, developmentally, the answer to that question is no, then that individual, instead of building autonomy, builds shame and doubt, at least how Erikson theorizes. Another piece that may ask you about adolescent clients, adolescents being in that 12 to 18 stage of development, as Erikson defines it. This is that identity versus role confusion. So questions surrounding an adolescent forming their identity by way of questions of who am I and what version of me is acceptable to certain social constructs that they identify with and belong to. These are Erikson's 8 stages of psychosocial development. Another major theorist that you will likely have some questions about is Sigmund Freud. Now, Freud, likely the developmental theory that you'll encounter are his 5 psychosexual stages. So not psychosocial like Erikson, but psychosexual stages. Here, specifically, Freud interacts with the concept of the libido being directed at different erogenous zones. So he's going to think of this developmentally, psychosexually, over 5 different erogenous zones that are reflected in a person's libido. One is the first stage is the oral stage, which is from about birth to 1 year old. Second is the anal stage, 1 to 3. The phallic stage is next from 3 to 7. The latency stage is about 3 to 5 to 12. So somewhere in there, like 3 to 12 or 5 to 12. And then the genital stage from adolescence on through adulthood. So in terms of someone's psychosexual development, this is not sexual development in terms of their physical sexual development, but this is how their libido interacts with, as Freud theorized at the time, different erogenous zones as that person experiences developmentally throughout their lifespan. 2 important terms that I would encourage you to be mindful of as it relates to Freud. One is that of regression. If you see test questions that have to do with the word regression, that can be a signal in your mind to say, oh, this is likely a Freud question. Because regression was one of the key terms in his psychosexual theory. And regression is the idea that someone, when experiencing stress, can actually revert to an earlier stage of their psychosexual development. And another word is the word fixation. If you see a question that has to do with fixation surrounding human growth and development, it again likely can be a Freud question, because this can be a person who doesn't progress from different stages of psychosexual development, but instead stays fixed in one specific stage. Again, most likely due to trauma or stress can be 2 major reasons Freud suggested that can happen. Moving on from Freud, we go to Piaget and Piaget's 4 stages of cognitive development. Now, sometimes folks get a little bit confused with Piaget in how many stages of cognitive development. And the reason why is even within these stages, there are various terms that are used within them. But I'm going to give you the 4 stages as they are major themes. And the first is sensory motor, which is from about birth to 2 years of age. In this stage, object permanence, which is another Piaget term, is developed. Pre-operational, which is from about 2 years old to 7 years old. This is the stage of development when centration is developed. That's the act of focusing on one aspect of something. From 7 years old to 12 years old is the third stage of Piaget's theory, and that's concrete operations. This is where, if you've seen the videos, the skill or the cognitive cognitive concept of conservation begins to develop. This is where you take some water and you pour it into a vessel of a certain size and shape, and then you take that water in that vessel and pour it into a different size and shape. And if it's the same volume of liquid, even though the size and shape has changed, conservation in this cognitive development is when a 7 to 12-year-old is able to look at that and say, oh, the amount of water didn't change, even though the size or shape of the vessel is different than the previous one. So that's something that in previous stages of cognitive development, Piaget suggested that an average child was not able to conceptualize that concept until this concrete operational stage. And lastly, formal operations. This is from about 11 or so to 16. Some of this does have to do in relation to neuroanatomy and the development of the prefrontal cortex. Prefrontal cortex is really the rational abstraction area of the brain. And the reason why formal operational in this stage Piaget highlights is that that's when the prefrontal cortex really begins to develop. Now, it's not fully developed. Neuroanatomy would suggest till mid-20s or so. but around 12 to 16 is when someone cognitively is able to understand more abstract concepts than merely just concrete ones. This is where symbolism or metaphors or imagery can really begin to form in someone's mind. Another Piaget term that I would encourage you to be familiar with is that of schema. Schema are patterns of thoughts and behaviors. And if you see the word schema, it's likely a Piaget question. Another cognitive theorist that will be really helpful for you to be familiar with is Vygotsky. Vygotsky, one of the terms most associated with Vygotsky is the zone of proximal development. It's this gap between what a learner can do without support and what they need support to be able to do. So if something is too far under the zone, or if it's too high over the zone, they can be paralyzed by an inability to do it, or it can be not challenging enough. But the zone of proximal development is really this place of where the learner learns best. Vygotsky was also significant in how he differed from Piaget. Piaget measured cognitive development as more innate to the person. These are the concrete stages, so to speak, concrete, sort of a pun there, but concrete stages that someone progresses through. Vygotsky suggested that someone's cognitive development is more impacted by the environment that they are exposed to. Which sort of laid a foundation for more behaviorists who went a different direction entirely in their theories of human development. Before we get to some behaviorists, I also want you to be familiar with Kohlberg. Kohlberg has 3 levels, not stages, but 3 levels of moral development. You'll note that these theorists focused on different elements of the human experience, and Kohlberg focused not on cognitive or sexual or social, but on moral development. These fall into 3 major levels, and that is pre-conventional, conventional, and post-conventional. Pre-conventional generally says that behavior is governed by consequences. This is, if you do this, you get punished. If you do this, you get a fine or a spank or a ticket or something. It's consequential. Conventional, which is that middle level, is a desire to conform to socially acceptable rules. So it's not just doing something to avoid punishment. It's to say, what is socially acceptable? Oh, other people don't like it or don't approve of me when I do this, therefore I won't. Post-conventional is self-imposed morality. This is when someone can say, regardless of if I get in trouble or not, regardless of what other people may think, this is a sincerely held belief, moral, faith, or virtue that I have that will now govern my experience of morality. So pre-conventional, conventional, and post-conventional. Another topic which isn't so much developmental, but is going to be good for you to be familiar with, is Maslow's hierarchy of needs. This is the 5 stages, or the 5 levels so far, 5 levels in the hierarchy that Maslow outlines. Foundationally is the physiological needs. After that is the safety. You've often likely seen this as illustrated as a pyramid or a triangle. So physiological is the foundation, with safety next, love and bonding. That can be some of the social needs at that 3rd level, esteem, and then lastly at the top, self-actualization. And Maslow even suggested that very few might ever reach that self-actualization piece. Now, looking at this as broad categories, you have theories of development that relate to behaviorism. These are theories that say all behavior is a result of learning. There isn't behaviors that are innate to a person per se, but most of it is a result of modeling or what is learned and taught. Then you have your constructivists that say, well, no, like Piaget, constructivists will believe that learners construct knowledge based on what they know and what they build on. So they say, oh, when they learn this, again, they're thinking of that scaffolding, one level on top of another. Humanism, those who think not just like behaviorists or constructivists, but humanists will say, well, no, let's go back to Maslow and say humans learn based on their needs and what needs are most salient in a given moment that they need to learn a survival strategy in order to cope with a specific situation. Lastly, another theory of learning in addition to behaviorist or constructivist or humanist is going to be connectivists. And they will say learning is not just grounded in knowledge, but really in the desire to connect with other people. So the four stages or four theories regarding how people learn are often entailed that way. Big picture, as you think of human growth and development, there are a few more developmental theorists that you can read a bit more about. These are the ones that you'll likely see the most questions about as you take the exam. A few other things to highlight is the impact of stress, the impact of what's called adverse childhood experiences, or ACE, and the impact of trauma. When you encounter questions in the NCE regarding human growth and development, be on the lookout for questions that specifically relate to adverse experiences or traumatic experiences, because that question may be asking you to think developmentally about the person and what stage of development they are in, maybe about their age, maybe about their cognitions, so that you can answer the question as informed by one or more of these human developmental theorists. This has been a video summarizing key highlights, strategies, tips, and tools for the human growth and development section of the National Counselor Exam, or NCE. I encourage you to look at follow-up videos where we will be tackling other topics in the 8 core areas of the NCE in order to better help you be prepared and to pass the National Counselor Exam. Thank you so much for watching, and I'll see you in the next video.